Virtual reality is forecast to see a massive increase in funding in the healthcare industry, reaching a market worth of $5.1 billion. Why is this? Well, an increase in availability to consumers, with consumer revenue reaching $4.5 billion in 2018 from $1.8 billion in 2016, combined with research into the use of VR in healthcare issues, has shown VR treatment can often be a viable and even a more effective treatment method. A 2016 study in India showed a 30% improvement when using VR exposure therapy for treating PTSD patients rather than a more traditional approach, which may suggest self-treatment of mental health issues is possible when using VR technology. This is further supported by the fact that virtual reality users are forecast to reach 171 million by this year. VR technology has shown that surgical training of staff can be made more cost efficient. Fundamental VR, a UK startup, delivers a software as a service simulation platform which is cheaper than single cadavers that they say can cost upwards of £10,000, while haptic surgery simulation solutions can cost in the region of £80,000, which less than 0.5% of world surgeons have access to. According to a Fortune article, America spends $3,000 per employee for tracheal insertion training, while Next Galaxy has developed a mobile VR software that trains tracheal insertion at only $40 per employee. VR technology has allowed new visualizations of patients for surgery. Students at the University of Illinois in Chicago have been able to model internal anatomy using 3D stereoscopic monitors with real-time visual feedback for a more accurate biopsy. VR technology has also allowed less invasive forms of surgical procedure to become more viable, leading to cost efficiency. A real-time simulation has been made for cardiac intervention using C++ and OpenGL by students from Zhejiang University and Nanyang Technological University that allows surgeons to view catheter and heart wall interactions in real time, allowing a less invasive procedure to be more effective when removing lesions. The long-term effects of the use of VR, however, have not been thoroughly studied, which has hindered the advancement of VR in recent years, especially for self-treatment. Cyber sickness causing symptoms such as headaches and nausea are the main short-term symptoms when using VR, which may lead to long-term issues if used often, which is seen less in the youth from one study. In another study, cyber sickness in those who are disabled, such as those who have MS, has shown different neurological reactions compared to non-disabled persons when using cyber sickness provoking VR. This may have devastating long-term effects until further research is done. Professor of Cognitive Psychology Mark Mann-Williams at the University of Leeds suggests that adaptation pressures due to design flaws in VR, such as the presentation of three-dimensional binocular images, may cause long-term effects which are currently unknown.